Sometimes a teacher gets a call right away. My kid has pain in the testicles, and he says, don't even wait for the next day in the office. Go right to the emergency room because it could be, the testicle could be twisted. What is that all about?
Testicular pain can be a true urologic emergency. This is one of the rare cases where urgent treatment is needed immediately. There are many causes of testicular pain. However, the most worrisome is called testicular torsion. Testicular torsion is when the testicle twists on its blood supply, causing severe pain and obstructing blood flow into the testicle. If this does occur, there's a limited number of hours, usually 6 to 12 hours, that the testicle needs to be untwisted to save the testicle from necrosis or ischemia. When testicular torsion does occur, there is very definite signs and symptoms. The pain usually comes on immediately, is severe, and in most of the cases is associated with nausea and vomiting.
In the ER, if you go there, they do a flow study or something? What's that?
What happens is that if any of these signs occur, the patient should be, or the child should be immediately sent to the emergency room, and a test to check for blood flow into the testicle should be done. There are two ways of testing blood circulation into the testicle. One is called a Doppler sonogram, which can visualize the testicle with a sonogram, and Doppler studies, which can visualize the flow of blood. A second test, this is a non-invasive procedure and is highly accurate. A second test is called a nuclear scan or testicular scan, where an injection is given to the child through the arm or through a vein, and the flow is followed through a camera to see if there's flow into the testicle. Both are highly accurate, and it's usually the preference of the emergency room doctor at the time to make the call.
If they have good flow, sometimes the doctor says it's not really a torsion, it's something else. What is that other condition?
There is a little appendix on the testicle, just like there's an appendix in the abdomen. The appendix on the testicle is a vestigial organ and can twist or become inflamed, causing a torsion of the appendix testes. This is not dangerous, it's self-limiting, but the problem with the torsion of the appendix testes, the most important issue, is separating or differentiating this from the torsion of the testicle itself. If there's good blood flow documented on the Doppler sonogram or testicular scan, this can be treated with anti-inflammatories and usually resolves within a few days.
Sometimes early adolescents, they get a little discomfort or pain down there. It's not a torsion. It's sort of like hormonal or something. What's that all about?
Yes, we do notice that in early teenage years or early adolescence, as the testicle grows or is having rapid growth, there is some patients or some children, adolescents, complain of discomfort. It's usually a dull, aching pain, which intimately occurs over many months. We don't have a full explanation of why this occurs, but if the pain becomes severe, we do need to check for torsion, because the peak age of torsion corresponds when this growth pain, as so to speak, occurs, early adolescence. This is usually best treated with Advil, and usually will resolve or relieve the pain.